Hi, my name is Jerry Sanamon. I'm an occupational therapist and certified hand therapist. Today I'd like to talk about elbow tendonitis, specifically lateral epicondylitis or tennis elbow. Tennis elbow is inflammation of the tendon that attaches on the outside of the elbow that allows for the wrist to extend backwards in this motion. The causes of elbow tendonitis and the lateral epicondyle is frequent repetitive use, heavy grasping and repetitive grasping exercises, activities such as swinging a hammer, swinging a tennis racket, or any other similar piece of equipment. Treatment begins with adequate rest and reduction of inflammation through the use of ice and heat. After the inflammation has been reduced, reconditioning occurs. Your therapist will work with you to recondition the tendon through strengthening exercises and stretching. Once you're felt to be out of harm's way, you will be encouraged to slowly reintegrate back into your normal activities, taking care not to aggravate that tendon once again. Prevention is key. Adequate rest, ice, heat, and stretching are all recommended.